Okay, we're here today with Mary, and Mary's about to start her treatment with Dr. Davis. So, Mary, tell me, what brought you into the office?
My knee. I've been having radiating pain down my leg.
Does it start in your knee and then go down?
Yes.
Okay.
And I've had muscle spasms. It's really hard to climb stairs, even to sit with my knees bent.
Right.
It'll just throb.
How long have you been dealing with this?
It's been several months.
Wow. And was this something that just happened suddenly, or did it come gradually, or?
It just started happening. I don't know. I mean, I try to stay active and walk around the block with the grandkids, and then I pay for it.
And then it really hurts.
Yeah.
Okay, so what is your discomfort level right now in that knee?
Right now, at this moment, it's probably about a 5.
Okay.
But there's been sleepless nights where I don't get any sleep at all because it's just radiating, throbbing, running down my legs, spasming. I've lost a lot of sleep.
That is not good. That is not good.
Not good.
All right. So I'm going to have you do a couple different things for me, Mary. The first thing I'm going to have you do, I'm going to have you just stand up for me. Okay, where did you feel that pain at, Mary?
Right here in the front.
In the front, like below the kneecap there?
Yep.
Okay, any other places?
No.
Okay. I'm going to have you take 2 steps forward. I'm going to have you put your feet shoulder length apart. Arms out in front, keeping your heels on the ground. I'm going to have you squat down. Yeah, I can see it in your face.
About there.
All right, slowly come back up. Where did you feel that at, Mary?
That was mostly in
That
the
same
front.
spot.
Yeah.
Because that left knee's worse than the right, huh?
Oh, yeah.
Okay.
Yeah.
All right, we're going to have you go up and down the stairs. Wow, I can see that, yeah.
Yeah, it's like I gotta really be careful how I'm stepping because it feels like it just wants to go.
Yeah, it feels like it's weak and it's just going to give out.
Very much.
Oh, wow. Okay, I'm going to have you turn around and go back up the stairs, Mary. All right. So, Mary, which was worse, going up or down the stairs?
I would have to say going down.
Okay. And out of all of those movements we just did, which one caused you the most discomfort?
Climbing the stairs.
Okay, the stairs. That's going to be your biggest
Yeah,
problem right
yeah.
there. Okay. All right, you ready to get started?
I am.
Let's do it.
Relief.
Pull up. 1, 2, 3, 4, 5, 6, 7 to the floor. Deep breath and up. 1, 2, 3, 4, 5, 6, 7 to the floor. Deep breath and up. 1, 2. There you go. 3, 4, 4, 5, 6, 7 to the floor. Alright? So the lengthening your hip flexor. Every time you lift your leg up, you have to engage that muscle.
We're going to walk down to the end of the hall and back.
Wow. This is what really walking feels like.
That's what normal walking feels like, Mary.
Wow. I don't have to jump. I don't have to feel like I'm not steady on my feet.
So you feel like your balance has improved?
Oh, absolutely.
Anything else that you notice besides you can walk normal?
Pain. No pain.
All right, we're back with Mary, and Mary's finished her treatment with Dr. Davis. So, Mary, let's see what you got. Can you stand up for me? No hands? Are you showing off?
No. Yes. I'm just so happy.
All right, 2 steps forward. Let's do that squat. Feet shoulder length apart. Arms out in front. How low can you go? Yes, look at that.
How about that far?
Wow. Any discomfort?
None.
Wow. Let's do the stairs.
Do I need to hold the rail?
If you feel like you should, because it was affecting your balance. So just, yep, just lightly. Look at that. Nice and smooth.
Smooth, no having to make sure it's not painful, that my knee's going to hold me.
Right, because you were
my
afraid it was
biggest
going to
thing.
give out.
Oh, yeah.
Right,
That was the biggest thing, was not being stable.
right.
And the pain.
Back
Can
up
I
the
run-
stairs,
can I
girlfriend.
run up the stairs?
You can do whatever you want. Look at that, even with no hands. When we started
no
out,
pain.
and no pain.
None.
So when we started out, what did we start out at? Your pain
About
level?
5.
Okay, what do you think it is now?
0.
0.
0. I have no pain at
Mary,
all.
what would you tell other people who are thinking about coming into the office? What would you tell them?
Please come. Please come. It will be a life-changing event.
Welcome aboard, Mary. I'm so happy for
glad
you.
to have found you guys.
All right, great. Thank you.